Hi everyone, welcome back to the channel. Heart attacks can happen to anyone, regardless of age, gender, or lifestyle. And while it's true that heart attacks increase with age, recent studies have shown a rise in heart attacks among younger people. In fact, heart disease is now the leading cause of death for both men and women in the United States. Therefore, it's essential to be aware of the symptoms of heart attacks in young people and to seek prompt medical attention if you experience any of them. The three main symptoms of heart attacks in young people are chest pain or discomfort, shortness of breath, and palpitations. Chest pains or discomfort is often described as a feeling of pressure, tightness, or heaviness in the chest that may radiate to the arms, shoulders, neck, or jaw. Shortness of breath can occur with or without chest pains and may be accompanied by sweating, dizziness, or nausea. Palpitations are a sensation of irregular or fast heartbeat that may be accompanied by anxiety, lightheadedness, or fainting. In this video, we'll discuss each of the symptoms in detail and explain how they can indicate a heart attack in young people. With the right knowledge and awareness, you can take control of your heart health and protect yourself from the risks of heart attacks. And please remember to subscribe to the channel. Remember, it costs you absolutely nothing, and it really helps. Also, give that bell a smash so you don't miss any of my new videos when they come out. So with that said, let's get started. Adults under the age of 40 are more likely to get heart attacks. If you're experiencing extraordinary exhaustion or faint after exercising, consult a physician. A recent study by Ohio State University reveals that many people under the age of 40 do not believe that they are at risk for cardiac disease. However, data on heart attacks from the previous 2 decades paints a different picture. According to a groundbreaking study released in 2019, the general rate of heart attacks in the U.S. has decreased since 2000, but the prevalence of cardiac events has increased among those under the age of 40. In addition, it was discovered that the group of youthful heart attack survivors had the same risk of dying from a subsequent heart attack as the group of middle-aged survivors. Preventive cardiologist Mark Katz told Insider that nonspecific symptoms like dizziness or shortness of breath are present in most of the majority of cardiac diseases that affect young individuals. The only guaranteed way to rule out a heart reason is to visit a doctor. Katz stated that sometimes a straightforward physical examination, such as listening to someone's heart, if you haven't subscribed, please think about helping me out there and subscribing and hit that bell so that you know when our next video comes out. And I will see you next time. Bye. 33-year-old Katz claimed that a few of his pals may text him for non-emergency medical advice. However, not everyone has a doctor at their disposal, and even doctors have failed to recognize their own heart attacks in the past. These are the three main indicators that everyone, including those in their 20s and 30s, should get tested for heart disease. Breathlessness during exercising, Katz claimed that after exercising for the first time in a while, several patients complained of having trouble breathing. Since they're attempting to get back into form, they're unable to respond to the straightforward inquiry, "Am I simply out of shape, or is this something more serious?" he stated. And according to Katz, the answer can be as straightforward as doing a stress test to gauge how the heart responds to physical exertion. The Mayo Clinic states that a stress test can determine if the underlying issue is obstructed blood flow, which would indicate cardiac disease, especially in older adults, or an irregular heartbeat, known as arrhythmia. Katz said, with younger patients, it again takes the one-on-one talk with a doctor to truly define if it seems more significant or not. Dizziness or fainting. Fainting is not usually an indication of a heart problem, but it might be a sign of decreased blood flow to and from the important organ. There are certainly indications that you should 100% see a doctor if you ever pass out, especially if you're exercising and you pass out, Katz added. He continued by saying that other symptoms like palpitations, lightheadedness, and dizziness should also raise red flags in young, healthy people. Irregular or erratic heartbeats. To rule out the potential of a functional problem, you should contact the cardiologist if you feel that your heart is beating too quickly, too slowly, or that it's missing a beat. Anxiety or stress may also cause heart palpitations, but according to Dr. Katz, anxiety is a diagnosis of exclusion for cardiologists. It's impossible to identify whether worry alone is making the heart race without a test to check the heart's rhythm and muscular tone. According to cats, anxiety sufferers frequently have palpitations that can both make them more nervous and cause additional palpitations. Even if there are no cardiac issues, a patient's worry may be reduced by visiting a cardiologist. A straightforward readout like an EKG can offer patients and doctors with additional information and peace of mind. Okay guys, that's all I've got. If you haven't subscribed, please think about helping me out there and subscribing, and hit that bell so that you know when our next video comes out. And I will see you next time. Bye.